I guess, well, you can start. Just give me, I guess, kind of your personal background, how that kind of applies to who you are now and why you're running for lieutenant governor.
Well, thank you so much, Liam, and it's wonderful to join you. I am excited to be the Democratic nominee for Lieutenant Governor, and it really has been a natural flow for me in so many ways. You know, I've spent the past 6 years in the Virginia Senate and serve as chair of the Senate Committee on Education and Health. And prior to running for office, I was a college professor. I spent 30 years in the college classroom, and almost 20 of those years were in the community college classroom. And the wonderful thing about working and teaching in community colleges is that you literally have the entire community in your classroom. I had first generation students, I had working parents, military veterans, I had so many folks from our immigrant communities. And that gave me an opportunity to understand the issues that are impacting so many families. And it really prepared me well for the work that I do in the Virginia General Assembly.
And you mentioned the work that you do and how you see the effects that certain things have on families. What would you say are maybe your top three pillars of your campaign heading into November?
Sure, you know, given the work that I've been doing as chair of Ed and Health, those first two areas are critically important. Making sure that we are addressing the critical needs of our education systems, whether it's pre-K, K through 12, as well as our higher education. I am adamantly invested in supporting public education, strengthening public education. You know, public education is the most important public good that we have as a country. And so we have such an important job in front of us to continue to strengthen and improve public education. And I'm also fully committed to protecting healthcare access, especially now when we're seeing the crisis coming out of Washington, D.C. with the HR1, the bill that has stripped away so much necessary funding. We're facing a crisis, most especially given the impacts of taking away Medicaid funding. We've already seen three rural hospitals, clinics shutting down. We have the potential to lose even more of those critical healthcare services. This is widening the gulf of healthcare access for so many hundreds of thousands of Virginians. Literally 300,000 Virginians may lose healthcare coverage in the next few months. So healthcare issues are top of mind for me. And then lastly, I've been working on many issues on housing affordability. So housing, education, healthcare, those are the three areas that I am most deeply committed to working on.
In the practical application to the education, what practical steps could you see Virginia taking if you were to take office and apply those to education and bettering education here in the Commonwealth?
Yeah, so you know, those are areas I've already been working on, and just some of those initial steps. One thing that we saw out of the research report that came out 2 years ago was that rather than actually investing in education through the state government, our state government had pulled back education funding to the tune of almost $6.6 billion. So that was a disinvestment that the state had made. And we have begun to address that and to add more critical, essential resources to our K-12 so that we can be competitive and provide the high quality education. So that's a first step is increasing the funding. I secured historic levels of funding for Virginians in the last budget cycle, over $2 billion dollars and another additional $800,000 recently so that we can really support the students in our communities. So those are some tangible steps that we are already taking, and I really plan to move forward in making sure that we continue that essential reinvestment of state dollars to support our local schools.
And along the same lines, let's talk about that affordable housing because that is such a big deal, especially here in Southwest Virginia.
So yes, we've seen in so many circumstances in every locality, the lack of housing affordability is impacting so many families. So there are certain ways that we can start to address that, and we have already started that process. When demand exceeds supply, then costs go up for everybody. So ensuring that we are building more housing and having more development is a first step in addressing the crisis of the housing shortage that we have. Increasing housing density in many of our localities has got to be an important next step. And I've been carrying legislation that I call Faith in Housing. And this is in partnership with so many of our faith communities, our churches, our temples, synagogues. They want to work in this space of providing housing to people in the community. And many of our faith communities have large properties, large tracts of land. They want to be a partner in providing housing resources. So there are some steps that we can continue to take in Virginia and bring some real concrete solutions to the lack of housing that we have right now.
Okay. I guess the last thing I've got for you, unless you have anything else to add, as a voter in Southwest Virginia, why should I cast my ballot for you?
Everything's at stake here in Virginia, and especially for our Southwest and our rural communities. And the contrast between myself and my opponent is crystal clear. I am someone who has the experience as well as the level of service in the General Assembly that allow me to hit the ground running as Lieutenant Governor. And I've spent a lifetime working in education and have secured historic funding for our schools. John Reed, by contrast, has said openly that he wants to close our public schools and that he wants to cut public education funding. And while I've been writing legislation to protect Medicaid, John Reed supports the bill that has come out of our Republican-led Congress that is stripping away healthcare access and critical coverage for hundreds of thousands of Virginians. And, I want to ensure that we have full protections for all Virginians for healthcare access on many levels. And this is an area that John Reed has consistently stated he opposes. So everything's at stake, but most especially for so many of our under-resourced communities. And I'm ready to do the work to ensure that we keep Virginia moving forward.